So thank you everyone for joining. So what we have here today is we are going to go over all of our experience building an XR asynchronous simulation lab for nursing programs specifically, but this can of course be applied to any health science or really any educational program that's looking to scale competency-based education. We are Intulect. I will go ahead and introduce ourselves here in a little bit, but to go over what the topics are today. Of course, we're going to introduce ourselves. We're going to talk about a little bit about our experience and what we saw for our nursing programs. And then we're going to go over all the little things that people don't know about when they first start the journey, whether it's focused on the XR technology, integrating immersive simulation into your programs. But what we're also talking about is how to make it scalable. So one of the problems for nursing schools specifically is the ability to scale competency-based education. Everyone's trying to transition to it. It's really difficult for one to get there and also to maintain it. And of course, there's a lot of barriers with faculty availability, space, time, and scheduling. So we're going to talk about all those little things that can get you to that point where you can actually scale competency-based education. And with those, we're going to talk about the tools that help you get there. So it's AI facilitation, and it's also, of course, XR, which we believe it's very scalable and it's very accessible, but also, of course, it helps with the realism too. So we're going to go over all the benefits of the tech itself, but really we're focused on really helping you understand the use cases out of it and how to actually scale this kind of education. So we'll go ahead and introduce ourselves. So my name is Kirkpatrick. I am the CEO of Intulect. I've been doing this for almost 5 years now. And my experience, I'm a nurse, but also a software programmer. So I have dual expertise. So I started this back in 2021 and decided to build a VR application. And here we are today. We're helping over 70 nursing programs. So everything that we're showing you today is just based off of our experience. So I personally have never been in your shoes as an educator, but Stephanie, that's why I brought her on here, because she has been in your shoes. She'll bring a lot of valuable insight on how to actually make this work for your program. So Stephanie, go ahead and introduce yourself.
Sure. So hi, everybody. My name's Stephanie Justice. I am the Director of Simulation here at Intulect. I joined back in August. I do have a cold today, so I sound a little funny. So I might have a big coughing fit in the middle of this, but we'll see how that goes. I've been doing sim, though, since about 2015, and I started with high fidelity, and I transitioned into the VR space probably about 4 or 5 years ago. And in my last job, I was the faculty lead in an XR lab. And we used Intulect for the last year that I was there before I joined the company. And I absolutely love VR Sim. So I can't wait to share what we've done and kind of where we're going.
Awesome. Thank you. So yeah, we're really excited to share just some of our experience, some of my experiences seeing it across a bunch of institutions. And then Stephanie's going to really get into like all the little details where you would be able to directly apply it into your nursing program. So we'll go ahead and get started. Does anybody have any questions before we do get started? There's a comment section where you can leave comments and ask questions. We're very open to it. And if you do have any experience yourself and would love to share, we're going to leave some time for a Q&A at the end, so we can invite you to to open your mic and, you can talk and we can ask questions back and forth. So would love to make it very collaborative if you guys feel comfortable with that. So, all right. So we'll be keeping an eye out on the chat there. If you do have any questions, please put them there. But just to get started, you all know this, especially if you're a nurse, we always hear about the nursing shortage. We need a lot of nurses, and there's a bottleneck from the nursing schools being able to enroll enough nurses to feed the workforce appropriately. So we understand that there's a lot of other issues that surround that. It's not just simply numbers. It's also related to all the operations of a nursing school and a hospital, of course. But there's limited educators out there too. There's not just limited bedside nurses. There's limited educators. There's limited space. And there's limited time to scale competency-based education. And how we solve it at Intulect is through AI facilitation tools. We'll go over that. We'll go over VR simulation and how it helps with the immersiveness and the hands-on activities. And then one thing is really important is performance tracking. So we're going to be able to get you data that you would never be able to get doing traditional methods such as mannequin-based sim, because educators only have so much time to facilitate, evaluate, and then also track all the competencies underneath each sim that you do. It takes hours and hours of time. Or if you use technologies like this that we're showing you today, then it can make it much more scalable and manageable for you in your program. So this is just, like I said, we're not going to focus on the technology a whole lot today. Well, of course, we're going to highlight it, but we're actually going to talk about all the little operational things that people don't think about when they go and start these kinds of things. So really what it comes down to is how we help leadership reduce training costs, scale it across institutions, standardize it, and get system-wide analytics. Educators, we want to reduce the admin burden for them because they spend hours and hours tracking competencies and mapping the simulations to their curriculum. And also too, customization is a huge thing, because, programs like us, for example, we can never make it 100% perfect for you. So it's nice to have those customization tools. So basically for educators, we want to make sure that you can not just do one simulation at a time, you can do hundreds of sims at a time through our AI facilitation. And then of course, students, everything applies to this. Humans learn by, repetition, right? So we want to give your students more access and make it more realistic and give them more feedback than they ever could get. So, all right, so this starts off with the fun part. So we're actually going to get into all of the little topics that people don't think about when they start an XR lab. And by the way, when we say XR, that's extended reality. That's family, I guess, an umbrella term for VR, which is virtual reality, which is the main focus today. But there's also other things such as augmented reality. There's mixed reality. All that really means, just when we say XR, VR, just think of the headset for this presentation anyways. You don't have to necessarily know the tech to understand what we're about to tell you today. But the big topics we're going to talk about is, for one, how can you build the right team? So what kind of players do you need to be successful in adopting something like this into your program? Two, what kind of equipment will you need, of course, for budgeting purposes, but also just for operations? Because whoever has experience in this knows that if you don't have the right tools and equipment in place, then it makes it much more difficult to be successful. Even the little things make a big difference. And then, of course, how do we create a good user experience? Because everyone's always concerned adopting new technology in the first place. But when you adopt something like virtual reality, it's even more of a concern because there's so many little things that could go wrong with your onboarding and your orientation. And it's extremely important to know exactly how it works best. So these are the three big topics we're going to cover today. All right. If anyone did ask, yes, it is being recorded, so no worries.
All right. That's what I thought, but I was going to ask anyway, just to be sure.
Yeah. Thank you for asking, because I did just check just to make sure. So it is officially recording. So thank you for checking. So yes, you all will be getting it. This will all be available on YouTube, for example, so you can watch this back. So you won't necessarily need like a private recording, but you'll look at our social medias. If you follow Intulect on LinkedIn, for example, or me on LinkedIn, or Stephanie, you'll see the link there to watch it later. So no worries about missing that. So first things first, we're going to go over personnel. So how do you build the right team to run an asynchronous lab? So one of the barriers we talked about, and I'll let Stephanie take over here, but just remember, one of the big barriers is there's an educator shortage. So one thing that we're trying to do is build an asynchronous lab, so that way students can come in on their own time. There's no scheduling barriers there. There's no education availability barriers there, because with these kinds of simulations, you don't need a facilitator. The educators can facilitate the program ahead of time and then allow AI to do it when your student comes in. So Stephanie, I'll let you go ahead and take over this topic.
All right, perfect. So of course, everybody, you guys all know that we need a really good team when we're going to be building, any type of lab, whether it's a high fidelity lab or an XR lab. You've really got to have the right group of people, the ones who can actually help manage all of the day-to-day operations. But with the XR lab, it's a little bit different. So the lab that I was part of, when we first started, we only had two of us. I was only part-time in it because I had my other teaching role, and I had a lab manager. Boy, did we learn a lot. Within the first couple months, we ended up getting some lab workers. And what we did for our lab workers was we used work study students. So it was a lot less expensive than hiring a whole lot of nurses, because they didn't have to run the simulations. They did not need to be an expert at simulation or nursing. they needed to understand the technology. So those are the people who can really help with like that day to day, just running, getting equipment ready, scheduling, troubleshooting, making sure that everything's cleaned and charged and ready to go. You also need someone in tech. Sometimes, I mean, we talk to a lot of people who have different labs, and sometimes the person who's doing all the IT is the nurse, maybe the manager of that lab. But if you are fortunate and you can actually work closer with your IT group, that makes your life a little bit easier because there is quite a bit of tech as far as like your Wi-Fi. How many access points do you need? What speed do you need? And I don't know about you, but I didn't learn that in nursing school. So it's something that I've kind of picked up and learned as I've been going. I was fortunate to have a really, really good IT group that helped me. The education champion, that was really like the bulk of what I did was I would help with mapping simulations, figuring them out in the curriculum, and working with the faculty. And it's really fun because we'd be like, "Oh, we want to work on this point." And so I would work with them to kind of customize and come up with something that made sense for their course. I actually used to help my group, my faculty, build their courses and help to align it within the system. It's something that they can do in our product, but the education champion can also work with them and help with that too. Of course, you're going to need some really good leadership. And one of the best ways I have found to get your leadership on board is to put them in the headset, to actually let them see what it is that you're trying to do. Because if you try to describe, oh, you're going to take care of a patient you can talk to, it's not quite the same till they put that headset on and they actually feel like they're in the room with that patient. Will and I have a favorite. His name's Henry. He's always my demo. Poor Henry's having a heart attack, but he's always my favorite. And when I put people in that one and they walk in and he's like, "Oh, my chest is hurting," it kind of shifts their thought process because it feels real. So to kind of help get the leadership on board, I highly recommend putting them in and letting them try it out. That gives you that buy-in from up above, and then it trickles down a little bit easier, I think. You can flip me to the next one, Will.
Yep, sounds good.
All right. So, stages of integration, because once you know you're going to do it, once you've picked your product, you have the the great fun of figuring out how to get it into your system and how to actually launch it. So, depending on your program, it's going to be different everywhere. We're going to want to be sure that we have our schedule set up. How are we going to integrate that into our class? When I first started, I thought I'll have them come in opposite of the regular sim lab. So they come in to do a high fidelity sim, half of them will come to the VR lab. Let me just tell you, for my staffing, that was a disaster because they run them from 7 a.m. to 11 p.m. and they ran them 6 days a week. And nobody wants to work that much. So we ended up switching to an asynchronous lab, which is actually what we're talking about here today. And so we set up a flow where students signed up to come in themselves. And it was really a very nice setup. We were open normal business hours. Then I met with all the course faculty. So we started talking about what do we need in simulation? And when you look at this, you also have to remember what are the really big strengths of VR and what are some of the limitations. For example, for me, if you're going to have somebody do a postpartum hemorrhage in a VR headset, you click a button to feel a fundus. You can't really tell that it's boggy or soft. You're going to get an indicator, but it's not quite the same. So making sure that you actually have something to pair with that so they still get the actual, like, understand what a boggy fundus feels like. I'm not an OB nurse, so I still don't really know. I remember from lab, but it's been a long time. The Ed champion, which was me in my case, is actually the one who usually does a lot of the customization. Your faculty can customize as well, but we found it was a little bit easier if we weren't training 70 people to learn how to do it. And we had one person that kind of focused in on it. That also worked very closely with the tech people, the lab manager, kind of the whole group. And we coordinated making sure that the simulations were tested and ready to go and up and available for students when they were supposed to. When we got ready to launch them, we had a grant and we started big. We put 700 people in it in one semester. I don't recommend that personally. I kind of like the let's kind of build up a little bit slower. Thankfully, they weren't all in there the first week, but it is a little bit challenging as you're trying to kind of build people and make sure you're meeting your competencies and that you've actually trained your students well. We'll talk about that just a little bit more in a few minutes.
Awesome. Yeah. So yeah, that from our standpoint as a vendor, you could say, so Intellect, we really thought it was we've obviously worked with quite a few programs now, and one I think is the best way for the education champion to be that point of contact for the vendor. And it's good to have that one point of contact because, like Stephanie said, the education champion is kind of overseeing the entire initiative. So they talk with course faculty and see what courses they can integrate and map the simulations into. And then that person will be a very valuable resource for the vendor to understand exactly what that content is and better work together with the software. So especially with customization that's available, it's extremely important. So that way, not only can we give them the simulation, but also get all the analytics you're trying to pull out of it, such as your competencies, and we can map those competencies throughout your program. So awesome. So moving on, and once again, if you all have any questions about any specifics, please put it in the chat. We'll do our best to answer it throughout, but we'll take the time at the end to do a Q&A for sure. So next is equipment. So equipment is extremely important, and I think Stephanie, you could probably speak from experience. I think one of the few things one of the things that people just don't know about until they get into the lab and see what they need, because even just the small things that go wrong, like such as I've heard many stories. Oh, we came in the lab and the headsets were all dead, and it could be as simple as not knowing that the headsets just don't have they only have a small amount of battery life in them, so it's about 2 hours at the most. And they have to be on a charge overnight too. They don't just keep their battery life because they wake up randomly. They have all these sorts of things, but just those little things that you just don't realize play a huge role in your success, because just having one day where you're just not prepared can ruin it for your students, such as because they're super critical if something goes wrong, right? Especially with tech. So we're just going to go over all the little things, such as of course your VR headsets. There's options there. There's of course the accessories that are involved with the headsets. Those are extremely important. There's some that you absolutely need, and some that maybe are just nice to have. And then we're going to go over the monitors and network, depending on your goals for that space that you have. So think asynchronous lab. No educators are needing to be there to facilitate the sim. So how do we make sure it's going to flow appropriately, make sure we're getting students in and out? Lab supplies. So those things such as for cleaning, charging, all that. So we're going to get into all the little details there. So compatible hardware. So of course, when you're choosing your software, you want to make sure that the hardware is compatible. So there's, like I said, many headsets that are available out there, but we will say that the Meta Quest headsets are the most popular, for one, because they're non-tethered, which means they do not have to be connected to a computer to work. So I always tell people, think of this like a cell phone, that they can be taken anywhere as long as they can access Wi-Fi, and you download the app on the cell phone, for example, and then you can use that. So that's exactly how these headsets work. So if you're planning on using multiple rooms or multiple different spaces or buildings at your campus, then that's totally doable with these headsets, because they can just travel along, and as long as they have access to Wi-Fi, they work perfectly fine. So the Meta Quest are the most popular. There's Pico as well. There's HTC. Those are but the Quest, it's also not as expensive, and that usually is why programs usually go with those. And then there's, of course, computer simulation. So with our specific program, we do have both, so we're device agnostic. But it's important, of course, to make sure that your hardware there is compatible, especially if you're planning on having computer as a backup, which is always good. Because you'll have students, we'll talk about this more in the user experience section, but you'll have students here and there that just can't do VR. There's sometimes just not compatible with it. So it's good to have this ready as a backup, and even students can use this for their personal computers that they have, and they can do this from any location as well. Silicone facial covers. Now this is, I say, an absolute necessity. If you don't have this, then you're asking for sweat to be collected on those. And unfortunately, speaking specifically on the Meta Quest headsets that are the most popular in the industry, they have cloth. So when someone sweats, all that sweat gets collected into that cloth at facial interface. So I'm not sure if my screen's a little blurred, and I'll try my best to show you. But the facial interface, when I'm saying that, is it's the thing that actually goes onto your face. So this area right here, now this has a silicone facial cover, but if I take it off, it's cloth underneath. So especially if someone has makeup or if they're sweating, all of that gets collected in there and it's pretty hard to clean afterwards. And it gets, of course, especially if it's wet, you're going to be getting people in and out of these headsets. They're going to be, of course, used in between. So you want something that's not going to be collecting all that stuff, and you can just easily clean it with a antibacterial wipe in between. So this is an absolute must-have for sanitation reasons, for one. Also, too, just for user experience again, because I don't want the person before me, I don't want their sweat in my face. So just from personal preference. So
Even on my own personal headset, I have silicone because I like to be able to clean it. Because if I play a
yeah,
game where I get sweaty, mine's like creamy natural is my color, I think, and then it's just gross.
exactly. And then there's I would say not a must have, but it is a very, very nice to have. It's very close, I would say, because for one, you could argue the default head straps that come with the headsets from the factory, they're cloth as well. So I have seen makeup get on those, and you've had to clean. Sometimes people have to clean those. So there is that reason, because a lot of the head straps you can get outside of those default ones are silicone faced as well. So any area that your head touches, it's silicone. So you can kind of tell in this picture, this one's silicone face. So you can use the wipe on those too for the back of the head area. Some head straps go on the top, and you'll clean those. So, but this one specifically, you see one of our favorites. By the way, you'll get to see our AI XR toolkit, and everyone who stays until the end will have the option to actually download it, a digital copy of it. So you'll get to see all the list of accessories that we personally like to recommend. So, and then another thing to final up on this. So that's one reason it's cleaning, but for the second reason, it's much more comfortable. So if you don't want, especially with some people who have haircuts that go up, for example, or they have their hair up, it gets really complicated when you have the cloth one. So these kinds of head straps are just much more comfortable, easier to get on and off, and they don't pull your hair, which is always nice. So, yeah. Any comments on that, Stephanie?
There's actually a comment that you can use an eye mask, so it's like a little barrier that goes in between you and the headset, but I haven't tried those yet. So if anybody has, I'd love to know what you think of them.
Yeah. Yeah, I just saw that. Yeah, I have seen people use those, but I've never seen them in person though. I think most people go with the silicone because it's reusable. And yeah, like you don't have to like take it on and off every time either. And it's just especially if you have a very high functioning or high flow lab where a bunch of people coming in and out. It's nice to not have to worry about that. So, all right, moving on. So we have the external battery pack. So as I mentioned earlier, the headsets last about 2 hours if you're lucky. It just depends on all sorts of things, really. But there are other options where you can have an external battery pack and just it plugs right into the side, as you can see in this picture. And they'll add, I would say probably more safely 1 to 3 hours of battery life. So you can have multiple ones of these and just plug them in and replace them, which is really nice. And if we go back to this picture, some of the head straps, this one specifically has a battery pack option that you can just attach right to the back of it and it'll charge it the whole time. These ones last a really long time. Once again, we'll have the list for you. These ones are, I would say, safely at least another 3 hours to your battery life for your headset. Just so you guys know, because these ones just a lot bigger, but it's kind of nice because it's on the head strap too. But these are really nice too because they're not in the way. Most of the time, people don't even notice they're there. So we've used those at conferences. So we did a conference last year when we got 50 people in the headset at the same time. And I think we did 3 sessions a day or something like that. So we were getting people in and out and it was consecutive. So we needed those external battery packs. And it's kind of, how you would run your lab too. You probably have consecutive sessions where students come in on an hour slot, for example. And, those headsets will die if you don't have them charged in between. You really just can't take them away and then put them on the charger because you can't use them if that's the case. So it's nice to have those external battery packs available. And then storage cabinets. This is a nice to have, not a must have. But really what it comes down to, when you're storing your headsets, just make sure that you can charge them. They have to be charged while they're stored. Because if you don't charge them while they're being stored, then they are going to be dead when you pick them back up the next day. They just don't keep battery life like that. And I've heard many stories that's happened to people. You can get fancy ones like this one pictured here. Once again, you'll see it in our AI XR toolkit. There's fancy ones that will even clean in between with, what was it called, Stephanie? It's like some kind of light, right?
Yeah, it's the blue light, like the UV light.
Yeah. So there's some cabinets that do that even. I'm not sure if it's really a good replacement, but it's still kind of nice, I guess, to have in between. Um, but
One
you can,
thing
yeah, go ahead.
I say one thing to remember with the blue light is that if your strap is laying on top of the plastic, the blue light can't get under it. So anything that has something else over top of it will not get disinfected. So we had a blue light. We did a combo at first, and then we just switched to the disinfecting wipes completely.
Yeah. Yeah. So there's a bunch of options out there, but I've seen people use just even basic cabinets as long as you can lock it up. And it's nice that they have wheels too, so you can take it from room to room if you have a bunch of headsets. So that's just one of the things that you want to look for when you're looking for a way to store these headsets. Then you have your traveling cases. So this is a really, I would say this is a nice to have, because I would say probably most programs won't be traveling with them, but if they're taking it from campus to campus for some reason, or if they're taking it to conferences, then this is a really nice thing to have. And those headsets are not, they're fragile, I would say, because they have cameras on the front of them, so they could easily crack those. And so it's nice to have something like this to take with you, of course, when you're traveling on an airplane, especially. So as you know, they don't usually treat those bags very nicely. So having a travel case is nice. All right, now getting into the supplies portion of this. So really just all the little things like how to clean the headsets, what to use, rechargeable AA batteries. I think that is a pretty much, it's not a must have, but it's something that is very nice to have, because you're going to be using a lot of batteries and the expenses over time would be less if you get the rechargeable ones, because those controllers use AA batteries. So you're going to have a controller per hand. And these things also die quite frequently, especially if you travel, because they turn on and off constantly. So those batteries die pretty quickly. So having a rechargeable is also nice. You can charge those overnight before your lab starts in the morning. Labels. So if you have 20 headsets at your institution, for example, you're going to want to label them. That would be something that your lab workers or your XR champion, your tech champion would be doing for you to make sure those are all set. So if you have a problem with the headset, it's very identifiable to what the serial number is and what the MAC address is, especially if one for some reason isn't connecting to the network. That's always a pain if you're in the middle of a sim lab and the headsets are just not connecting to the network. So labeling is super important because they all look the same. And then floor tape and boundary markers. So we'll get into the lab setups here in a little bit, but having that just so you're setting enough space in between users. And Stephanie, actually, I think it would be good for you to kind of explain how you all did it. I think that's the next page here. And this kind of resembles what you all did. It's just a very small picture of kind of the smaller version of what you did. So I would love for you to explain kind of how you guys did that.
Sure. So we had a big empty room. It was a nice big room. On one wall, we had desks for people to put their computers and also put their bags, because you definitely don't want them to set their backpack anywhere near their feet because they can't see it when they're in the headset. We set up just like the corners. We put up 4 corners. They were 7 by 7 squares. And in the center, we had like a little diamond for the person to stand on. And then they could draw their boundary around that square. And that gave them a little bit of room. It was bigger than a stationary, but it didn't have them walking into walls or walking into each other. Because that's one of the problems is when they're in a sim and they don't see someone and they stick their arm out. You don't want them punching walls or somebody else. So we found that little setup worked really well. We used colored masking tape. It showed up really easily. But the funny thing about it was after we took it off the carpet, it left permanent little like black marks on our carpet. So you could always see them. Like that's not going to go away, I don't think, forever. But it worked really, really well to set up our boundary and keep it nice and spaced out.
Yeah. Yeah, I think this is probably the most popular setup that I've seen across institutions, that because it's easy, actually. You don't have to get a bunch of, room like furniture, for example. It's just an empty room, and then you can get tape and, like Stephanie said, and just mark all your spaces up and people come in and out. and they had their storage cabinet to the side and have the headsets so students can sign in, sign out of the lab, do their sim, and then sign out and leave. So after they clean it and everything. So this is probably the most popular. There's other setups as well, such as your hybrid station where you kind of do a little bit of both, where every station has a chair. Because some, me personally, I like to stand when I do the simulation. Some people like to sit. But if you do have an option for sitting, which every lab should probably have an option for students who want to sit, at least something, if you're going to do the minimalist lab setup, having some chairs off to the side just in case is a good idea. But for these kinds of setups, every station would have a gaming chair, you could say, that swivels, something that you can turn around with, because you don't want them stationary and only be able to face one way. Because in VR, especially, you have to move your body and kind of look around like you normally do. But this is one of those things where you could set up where you have, think the PC version right there, you have a casting monitor, you have your headset, and they can all just be right there at their station. So that's another one I've seen. And then mobile VR cart configuration. So think of this as you could literally just have a setup where you have your headphones, everything there, but you can travel with it. So like kind of how nurses travel with their mobile computer carts to patient's rooms. This is kind of the same idea where you can take this from any room, especially if you have a bigger sim lab space where you might want to be going from, if the sim labs or rooms are like divided by walls, of course, then this might be a good option for you too. So I've definitely seen this as well. So have any of you done something different, just out of curiosity? So if someone has XR or VR simulation section into their sim lab, would love to hear from you if you have something that you've done differently and if it works well for you. Feel free to put it into the chat there. We would love to, we can highlight it even. So we'll keep an eye on that. So if you have something, we'll definitely highlight it and talk about it today. And then, so we're still on the section for equipment and accessories and supplies. MDM softwares we kind of included in there because it's kind of an accessory, but really we say anymore, especially if you have a lot of headsets, it's kind of a must-have. It depends on the amount of headsets, of course, but there's options out there. There's Meta for Education, and there's Arbor XR, Manage XR. But really what this does is help you manage, of course, the headsets from multiple locations. You can deploy new updates from various different applications. So especially if you have more than one program using it. So if it's not just your nursing program, but you have other health sciences or even other completely different programs using the same devices, this is definitely going to be something you're going to need because you're going to be managing multiple apps. And it also helps secure the headsets too. So that way students can't go in there and just download random apps, because that's definitely happened before. But this is just something that you guys want to keep an eye out for when you're considering adopting, and especially when you're purchasing the headsets, because you need to know before you purchase the headsets whether or not you're going to go with an MDM. So,
and one of the really nice things with the Meta for Education is you can set up your lab workers as a facilitator. And if someone is having trouble, they can request to see what's on the screen on their computer, so they can kind of walk the person through, like maybe, oh, your menu's behind you, turn around. That kind of thing that you can't see when somebody's in a headset.
Yeah, that's super important because everyone wants to cast, especially if you're doing a group simulation. So just imagine this kind of setup, or of course this one where you have the big monitor, right? So if there is like a lab worker, for example, trying to help the student troubleshoot, because that would be their job, getting students in and out of headsets. If students reporting an issue that they can't get past some portion of the sim, like Stephanie said, if you have an MDM, it makes it much easier to cast. You can still cast without one, but it is difficult. It's pretty difficult. So the MDM does make it pretty easy, like you said, so you can control it from your side instead of the other way around. Because if you don't have an MDM, the student has to know how to start the casting, which is usually not something they understand how to do right away. So that's a very good point.
That's my favorite part in there.
Yeah, yeah. Because everyone wants to cast, especially it's good to share what's going on. So then talking about the AI facilitation tools. So this is specifically just our product that we're wanting to highlight how you can do it asynchronously. So like I said before, for the educator, we want to be able to allow your educators to facilitate hundreds of sims at a time instead of just one. So at the same time, they're facilitating, they're evaluating, and also tracking the competencies and mapping it to the curriculum all at the same time. But they don't have to be there with every single student doing a sim. The student does it on their own time, and all that data just flows into your lab basically. So this is just a quick little highlight reel of various things that you can do in sim in our VR and PC sim. Everything's hands-on. So one thing we would like to highlight here is not only with the older technology, everything's menu-based, and you're kind of relying on students to make clinical judgments by looking across the menu, and that makes students very task-oriented. We're on the other hand, where we want your students to be performing actions and making decisions the same way they would with real patients. So you're going to actually see how confident they are in various things and how they make their decisions, because it's kind of a free world opportunity to do so, and you can make mistakes. So, and you get to see in like deep analytics on each individual how prepared they are to treat patients in various different categories. So,
And you can ask our patients anything. That's my favorite.
yes. And I'm not sure, let us know in the comments if you can hear sound. This is just an example of the AI patients. This is Henry, our favorite.
I don't have any sound on mine, Will.
Okay. Let me see. No sound. Okay. Well, just imagine. I'll maybe figure it out here in a second, but just imagine you're talking to them and they talk back to you. It's very dynamic. But since you can't hear it, let me just stop this video. So these AI patients, they can be pretty much your standardized patients. So you can create them, customize them, and then use them for any scenario that you want to put them in. So this is very common for soft skills training, cultural sensitivity, de-escalation practice is huge for health systems especially. And these AI patients have personalities and they have knowledge just like you and I do. So the first patient you just saw is Henry. That's one of our favorites. He's the one that always has the heart attack, unfortunately. But the nice part is that Henry can also play any other simulation too. He doesn't have to have a heart attack in every sound. So that's how customizable it is. I'm trying to pause this video here. It won't let me pause. But anyways, with the customization tool, you can customize their knowledge. So you give them just knowledge just like anybody else has knowledge about themselves or their situation. So it's not a script. You just simply talk, and you can ask any question. So it doesn't have to be, it's pertinent to the case. Even it could be completely non-pertinent. You can do small talk with these patients. And they have personalities and emotions, so it actually matters what you say. And then based off how you communicate to the patient, that they will dynamically respond to you just like you and I would to anybody. So, all right, and then there's the AI facilitation. So you can create and make sure the simulation goes the way you want it to go. So if you know that you're going to be giving your student the opportunity to get an order from a doctor that maybe was incorrect, for example, they got a fluid bolus order for a heart failure patient. Well, you're hoping that your student knows and identifies that this is not a good order for this patient because they have heart failure, but let's say they did give it. So now a whole nother pathway goes on and shows that student what exactly happens in real life versus another student who maybe made the right clinical judgment doesn't see that because they did the right thing. So that just gives you an idea that educators can facilitate sims from afar now instead of having to be there one-on-one with the student every time. So, like I said, we're not going to spend a whole lot of time on the tech today because we wanted to give you value and understanding how to get things started in your lab and build an asynchronous lab. But if you all are interested in learning more about the tech part that I just showed you, then definitely we have some links that you can book some intros for and get a demo. So, all right. And then customization, same thing. So like we said, especially us, we understand that we're never going to make a sim that's 100% the way you wanted it to go. So we want you to be able to create your own AI characters, your own rubrics, and how you want to collect the data and track and competencies. And then, of course, the scenarios that you give your students. So, and all of it can be stored on an LMS, and all the data can be there to be evaluated and use it to improve your curriculum year after year. So that's how you can do it asynchronously with the technology. Because without technology like this, then you're forced to still do your traditional methods when you have to be one-on-one with each student and do facilitation and evaluation at the same time, which limits your ability to get analytics that deep that you can see here. So,
And we did have a question, Will, that popped up about referring to sim workers if they were the sim ops specialists. And I did type my answer in, but just in case someone doesn't see it in the chat, my lab workers were actually my student workers. So minimum wage students who knew how to work the system, knew how to work the headsets and take care of everything and kind of do some basic troubleshooting. But they did not know which of the simulations, like they weren't necessarily a nursing student, which was really nice. And it was very helpful.
Yeah, I've seen it. So with your case, I feel like that was the most common way of doing it, but we've seen programs even use their standardized patients to help in the lab. So day-to-day operations and stuff, whatever you can get is what I've seen other programs do as well. So that way educators don't have to be there to be the ones getting the students in and out of the headset because they already have plenty to do. So, and that would defeat the whole purpose of what we're trying to help you achieve too. So yeah.
And
Good
then
question.
we have another one.
Yeah. So, do you have a list of LMSs you can integrate with? Yes, we do. But the one I actually just showed, we have our own in-house built one. So all of the data gets centralized for you. It's kind of think of it like your simulation LMS that you can tie in other pieces of your content together too. But yes, we do have integrations. We can definitely share that with you. But of course, we won't be doing that here because there's just a lot of other content that would take a while. So we definitely do have the opportunity to share that with you, though. If you do want to know more details about the product specifically, then definitely book an intro with our team, and we'll show you everything it can do. So
Perfect.
awesome. Thank you. Thank you for the questions, everybody. So I believe, Stephanie, this is your section because this is where you shine and where you have the most experience. So
Well, and the funny thing is Will says I shine at this, but the first year that we did this, we made so many mistakes. We didn't exactly shine for quite a while. So one of the things that it was very challenging for me was when I first got my VR headset, my own personal one, I put my son in it. And 2 seconds later, he's jumping around the living room, dodging beer bottles. I don't know what game he was playing. He was throwing ninja stars. I don't know. He looked crazy. And I was like, oh my gosh, my students are going to get this so easy. They're going to love it. And I put a bunch of nursing students in it who had no idea how to hold the controllers, how to work the controllers. And we created technical debt because we didn't give them a solid orientation. They're not gamers. My son's a gamer. So, if you're familiar with the headsets, if you take the two controllers, put them together and angle them, they look like a PlayStation 5. They look like those controllers, have the same buttons and everything. So, we have a recommendation to actually help you not make that mistake that I made that left. We had to correct it and it was not easy to do. So, we actually have some onboarding steps, and it's kind of a way to ease them into it. When I first started with our VR lab, we did not have a PC-based. We were using a different product. It did not have one, but I sure wish we would have, because you can actually have them get used to what the room looks like, kind of where things are, what's in the drawer, what's over here. And it kind of reduces some of that cognitive overload. It's a nice way because you can also walk around. It's easier to look at, 100 PCs than it is to try to get 100 people to screencast. I wouldn't recommend trying that at once. And then we use First Steps, and it's if you haven't done it, it's a free app from Meta. It's really fun. It's kind of like Disney on your face. I mean, it even has a monorail, and then you're gonna throw paper airplanes, and you're gonna hit stuff like a little ping pong ball and dance with a robot. And the funny one is there's one over here where you hit a little punching bag off to your right. I duck every time that thing comes at me like it's really going to hit me because it feels real in my headset. It really won't hit me because it's not there, but it has that immersion and that sense of presence in there. Students should only be in the headset for about 10 to 15 minutes at a time. And that's really important because otherwise they can start to have some more problems with cyber sickness. And I'll talk about that in a second. After we have them do their first steps, we start them on orientation, because orientation is where they're going to learn how to work the specific controls for their simulation. If you use a different company for VR sims, it's going to be different than ours. Everyone has certain ways, whichever buttons that you use to make your avatar do certain things. We actually have 3 different so that they're all nice and short. We have one on like navigating. We have one on like grabbing and touching and picking up things and moving around in the room. And we also have one on medication administration. Too long to do all 3 of those at once. We like to break those up, give them a little break in between, let them, take a good 10, 15 minutes out of the sim, out of the headset. Nice time to kind of talk about it. We also love these little micro sims, and it could just be something like go in and talk to your patient, which actually is a great simulation, even if it is part of just, you're thinking, oh, this is just orientation. But sometimes our students, and I saw it frequently, they struggle with having conversations with patients or how to ask patients questions. If you've gone with them into a clinical setting, a lot of your traditional undergrad students kind of hang at the door and don't know what to say to the patient. This is a good, safe place for them to practice that talking. And if they have to teleport around the room and do a few little things in this really short little sim, that's very low stakes. It's a great way to get comfortable. Then they can go on to that full blown sim. Now, that full blown sim is going to have your whole pre briefing, it's going to have your simulation and your debriefing. But remember, about 15, 20 minutes in a headset at a time, they really need to take those breaks in between. I wouldn't do all of that in one day. I would do that over a couple days with the students so that I don't have people who get not feeling really well in there. We can go to the next one. All right. So, cyber sickness. That is that feeling of unwell. It can be your things like nausea, dizziness, eye strain, headache. That could be a big problem when people are in that. We'll talk a little bit also about visual impairments and glasses and what I saw when I was working with students in this space. Cyber sickness, a lot of times it has to do with if they've been in the headset too long or if they move around really fast. That's one of those things I noticed. People that whip their head around really fast in their headset tend to get really woozy because the screen doesn't catch up to their head. I'm sort of the oddball because I like the teacups at Disney, so I can spin around in those. So I can spin around in a headset. I don't recommend that for most people. You do want to start them kind of slow, about 5 to 10 minutes. Sometimes people like to be seated their first time, and sometimes that's more because they're on TikTok a lot and they see people fall in the headsets. But you want to go to their comfort level because you don't want to scare them to death when they put the headset on. You can switch to the next one, Will. I did on my little notes over here and forgot they hadn't caught up.
Yeah.
So the 3 touch rules, so that's going to be like your introduction and a guided practice. They really do need to know what's going on. I used to do a lot of a screencast and have them hold the controllers, and I would be like, the AB buttons go in your right hand and the XY go in the left. And I should do things and talk them through the buttons and have them pushing them. And then the second touch is when they're going to do their independent practice. That's why we have the orientation sims, because they need to practice so they're comfortable. If you want to make a student or a learner really uncomfortable, put them in the heart attack sim with Henry, and he starts having chest pain and they don't know how to pick up anything. So you want to build them up because otherwise there's this stress of, I don't know what to do, and it's immersive and it feels real. So we want to do these little things, a demo and then some practice. Let them learn how to do it before they have the pressure of their patient is very, very ill. And that's the third touch. That's when they're actually going to do like the entire sim where they're going to integrate everything together. That helps with the cyber sickness if each one of those is a separate activity with breaks in between. External factors in your headsets, the lenses actually move in and out, and that changes the interpupillary distance, and that reduces eye strain. So if you've ever put one of these on and it's really blurry, sometimes you need to like lift it up or down, or you need to move it around a little bit, or you need to adjust those inside lenses. Depending on the type of headset you have, sometimes it's like you physically move them, and other times there's like a little dial underneath on the left eye to move them. If you have someone who totally just cannot get past the cyber sickness, and that does happen, it's not very common, but it is nice because they can do a screen-based simulation, or they can also, observe or be a spectator. I have done them before where I was their proxy. So I put the headset on and they had to tell me what to do. This was when we didn't have the screen based. The beauty of the screen based is they don't need to tell someone to do, they just do it themselves. And we can move to the next one.
All right, yeah. So just moving on to the other considerations. So there are sometimes, especially at conferences, of course, you're going to have students as well that have eyeglasses, and usually we don't have the accommodations for them, but because it does depend on the frames, and you'll see sometimes it really just depends person to person. Sometimes they don't need the glasses, and it'll be just fine. They can see just fine without them because the lens are very close to your eyes, but sometimes they do need the glasses. So there are, on the newer headsets especially, there are ways to space it out so it leaves room for glasses. So there's that accommodation. There's also even inserts now that I've just seen recently that have been more and more popular. It seems like they're working pretty well, that you can actually apply on the lens, and it has to be for each person specifically, but they can actually purchase something that will go inside the headset and it'll fit just right. So that way the frames have, you don't have to worry about the frames. They can take the glasses off, put the inserts in, and it'll work just like their normal glasses inside the headset. So, but yeah, usually that's not a barrier. There's usually a solution around it, but that is a common one that people ask about or are concerned about. Visual blur, like Stephanie said, really just a lot of messing around with it because everybody kind of has a different, orientation. Everyone's eyes are, distanced differently. So you have to kind of mess around with it, see if, where it is clear. And then that's where you get the headset, tight on your head. Make sure you try to mess with the blurriness first and then, tighten on your head. So don't just accept defeat and allow it to be blurry because that is not normal. So, and then sometimes if the lens are dirty, you want to clean those with microfiber cloths. There's even some sprays like you would use for glasses, for example, that you can use on these headsets. And then, of course, sometimes there is going to be visual impairments. It's going to be case by case. But I have actually known somebody who actually only has vision in one eye, and it actually worked just fine for them. They were able to use it, which was very surprising to me. I did not think that it would work because how the headsets work is that one lens shows you, of course, the left side of your visual part of the sim, and then there's the right side. So I did not think that the right lens, for example, would show everything to the left, but it actually did work for them. So usually, the headsets are more accessible than I originally thought they would be. There's always an alternative around it. So, and then there's, of course, hearing impairments that you have to consider. A lot of the times, a common mistake that I've noticed recently is that they'll say that they couldn't hear anything on the headsets, and every headset has a volume button on it, and it's super easy to accidentally hit and then put the volume all the way down. So that's one thing. Make sure you check your volume setting on your headset. Sometimes, of course, it gets pretty loud too. So you kind of want to keep it in the middle, at least for my preference anyways, unless you're trying to share what the patient's saying around you, for example. There are external headphones available, which can be useful, especially if you have a giant room and a bunch of people doing sim at the same time. But like I said earlier, we had a room full of 50 people in the headset at the same exact time, and it wasn't too bad, but that room was pretty big though. So it just depends on your space, whether or not that's something you would want to get. And then there are subtitles for communication too, to accommodate that if they are difficult of hearing. And then, of course, you can think about, well, what happens when everyone's talking, and what if someone right next to me talks to me and the patient thinks I said that to them? Well, that does happen. It can happen. Some ways you can do that is wear headphones for one, because, of course, it won't block the mic out, but it will kind of make everyone isolated in their own worlds of things so they can't be distracted from everyone else. That's for that reason. But a sound machine actually has worked in the past for some people. So what we've noticed that the more people that are talking, the less likely the patient can hear someone else talking because it's this background noise at that point. So for example, at conferences, when we have a bunch of people there, everyone, the room's super loud in the exhibit hall, hundreds of people are talking, right? But we've noticed that the room's louder in the background, then it's less likely that the patients are going to hear someone else talk. So using a sound machine can work really well for your lab space if that's something that you're having problems with. And as Stephanie said, that 6 feet spacing in between users, obviously for one, so that way they don't bump into each other, but for two, so that way it reduces the chances of cross communication. So
And then talking about scheduling and kind of that operations and flow. The way we ran our lab was our students, we used bookings, which was part of our Microsoft Office. Our students would sign up for their own time. They'd sign up for a 1 hour block, and our course faculty would give them a couple weeks to finish. We had classes of about 180 students per level. So they'd have a couple weeks to sign up on their own time and come in and do their sim. So they would log in, and we actually had a card swipe where it used their ID so that they could come in. Then they would pick up their headset, they'd look at the pre-briefing on their computer, they'd review that. Then they'd go in and do their simulation in the headset. And then immediately afterwards, they would turn that into my lab workers who would clean it and disinfect it and plug it in. They would type out their asynchronous debriefing on the computer. I used to customize ours so that they matched the same format that we used in our lab. So that if you use, pearls or debriefing for meaningful learning or plus delta, you can actually customize it so it follows your typical questions. And then we like to bring them back and do a synchronous debriefing after everybody had finished. And I know that, we do have the sim standards, a best practice, and they really do like the asynchronous. I was happy to see that in there. But I like to do a little bit. It doesn't even take that long, but to do a little bit of a synchronous debriefing, because sometimes students get things in their mind that they think is something wrong in the sim. So, for example, I had a student who said, if the simulation would have worked when I put oxygen on my patient, they would have been fine. Their patient was in respiratory failure with a SAT of 70, and they did 2 liters nasal cannula. So that was one of those things that you actually have to talk to them about, that that's not right, right? That they actually needed a different mechanism of delivery. They needed way more oxygen than 2 tiny little liters going up their nose. So I personally really like that combination. And we got some great conversations going with students on how their sims went and how they felt about it. But they could pull back up their asynchronous debriefing in class and look at it so that they didn't forget. Because I know I always joke around that I don't know what I had for lunch last Tuesday. I'm not going to remember what I did in sim 2 weeks ago. I just won't. I know that. So we can flip to the next one. I know we're starting to get a little short on time, so I'm not going to read all of this to you. But what I'm going to say about this is, when it comes to your pre briefing and your debriefing, this is still simulation. You still need to follow all of the sim standards, right? We need to make sure it's a safe place, that is psychologically safe, that they know their objectives, they know what the outcome is, what's expected, and that they understand how to work the equipment, just like you would with a high fidelity mannequin. It's all the same sort of thing of, you have to make sure you do it all. If you don't, you're going to end up having students really frustrated and very, very unhappy with you, to say the least. So I don't want to read all those to you, because I think there's some other stuff we should probably hit.
yeah. So yeah, just knowing that there is options to do pre-briefing when you're doing asynchronous sim, because with us especially, we don't want you to have to change the way you do sim. It's just another modality, but we're going to make it more scalable and keep the quality as well. We're not trying to sacrifice quality in the sake of scaling. So one thing that we've recently done is doing the AI facilitated pre-briefing, and it's probably not going to play sound for you, but I'm going to just kind of let it play in the background here as I explain it. But what you can do is you can create an AI charge nurse, for example, and then you can get your SBAR report, and then you can talk to them and ask questions, clarify things, and that way that your students can prioritize during a multi-patient sim, for example, and all those sorts of things. So that way your students know exactly what the key objectives are, and they can know exactly what the key objectives are. They're not just reading it off a piece of paper, for example. So that way, once again, your educators don't have to be there during the time they go in the sim, but they can still have all the control and guide the student the exact way they want. Because especially if you have your fundamental students who need a little bit more guidance before they go in the sim, there you can really make it specific for that learning group versus your senior students who maybe you want to give them the feel of a real environment, a real scenario. Then that's totally something you can do too. So it can be tailored to the students that you have in front of you. So, and then Stephanie, I'll let you kind of describe how you were able to do debriefing still with an asynchronous lab.
Yeah, so like I said, what they would end up doing is typing their debriefing immediately. I didn't want them to wait too long because, I really want to make sure we catch those um their actual feelings on how they felt about the lab and their takeaways and what went well, what didn't go well, so that it was fresh in their mind. When we would bring the whole class back, I had a couple classes that did it by clinical group. I had some that would want to do it with the entire class. And then they would go through after the faculty had looked through their debriefing, because it's really nice. You can go into your course and you can read everything and read their comments. And, like, for example, with the student with the oxygen, that was in her comment. And I was able to, kind of clarify that and make sure that they didn't think that the system was broken, because I don't want them doing that on a real human. So if I personally love that little bit of follow up with that synchronous afterwards. We would usually do it 15, maybe 20 minutes or so in class with 180 students. So it wasn't anywhere near as time consuming as it is in your high fidelity lab where you're debriefing after every single sim. It was a little bit easier.
Yeah. So we'll leave this open for Q&A for everybody. So if you do have any questions that you're holding on to, let us know. And just to also kind of, since we're short on time, I just want to let everybody know. So we'll be at IMSH. So if you are going to IMSH, we would love to see you there. So if you want to see the simulations in person and talk about how we can help you scale competency-based education into your curriculum, come to booth 1111. It's 1111 is actually a little easier to say, I guess. But we're also doing a raffle. So five institutions will be chosen for our $10,000 grand prize. So we're giving you $10,000 worth of nursing simulation licenses to use for 3 months. So that way you can get a nice pilot going. And, if you want to present to leadership and make your case and see if this kind of solution will be good for your program, this is your opportunity to do so there. So all you have to do is come to the booth, register, go put a raffle in. There's other opportunities to get more entries as well, such as doing a sim. And whoever does actually get the highest score automatically gets one of the prizes. So with that, we also just recently announced that you're going to get a free cruise to NurseCon at Sea. So whoever wins, whoever gets the first place score on one of our simulations, will actually get automatically that cruise. So I think it's up to about $4,500 worth of value there, and it's for 2, so you can bring a friend. And that's just something we recently announced. So definitely come by IMSH if you're there, if you want to be put into this raffle. And then lastly, if you're wanting a copy of our AI XR toolkit, so it provides a lot more details. So this slide was pretty much like a summary of everything that we shared from this toolkit. So I don't know if you can see my screen or not, but here's a copy, and the winners at the IMSH raffle will actually get a physical copy, but you all have the opportunity to submit your information here, and then you'll get a digital copy of it. So if you want a copy of that, definitely scan that QR code. If you can't scan it, let us know. If you're on your phone already, that's probably a problem. So what we'll do is I'll put in the chat here a link that you can use, and then we'll allow you to submit your information there. It should take about a minute or two, but we'll wait a couple minutes for any questions as well, while I go ahead and get that link for you.
We do have a question on how much time for each student to complete one scenario. And in the lab that I ran, we did 1 hour. And that included their pre-briefing, setting up their equipment, doing their simulation, and then the asynchronous debrief. The sim itself is really about 15 or 20 minutes. It's not super long. But we always wanted to have a little bit of extra time in our window in case, like, the controller batteries were dead, or we had to do some troubleshooting, or the Wi-Fi went crazy. But we found that was a very comfortable time frame to move the students through without being very hectic, especially if everyone comes in like at the top of the hour. We could run up to 12 people in our lab at once, and so that was really pretty nice. We have a question of, is the QR code for the $10,000 pilot? Because that's what it appears to be.
Yes, go ahead and submit that in. It's also that way you can simultaneously, if you are going to be at IMSH, it gives you, since you guys joined today, you get an extra entry into the raffle. So it's kind of doing two things at once. And I just put the link in down there in the chat for you. If you are interested in getting the copy, and also, you'll automatically put in for an entry too. So, and if you can't scan the QR code, I just put it in the chat if you'd like to use that link instead. Any other questions from anybody? And if you already have experience in doing this, please let us know. We'd love to learn from you as well if you have any other suggestions. We'll stay on here for about 2 to 3 more minutes, and unless we get some questions coming in here.
So there is a comment that it's not for the AI book. Is it that they get the book after they register? Is that how that works?
Yeah, so if you'll get the book, so we'll know if you registered, and we'll send you a digital copy of it. So. Thank you all so much for taking the time. And like I said, this will be recorded. So if you want to watch back and refresh on anything that we talked about today, you will have the opportunity to do so. It'll be on our YouTube and our social media. So if you want to follow Intulect on LinkedIn, it'll be on there. We'll probably post it up here shortly. So, anybody else have any questions or comments or suggestions for us? All right. Thank you, Kimberly. Appreciate your time today. So we have one. Yeah.
I see the question from Daniel. What we did for ours in that was it counted like as homework because it was something that they had them do outside of class. I have seen people who've built it into their lab time, into their lab hours. And in some states, people can build it in as clinical replacement. That all varies by boards of nursing. But we actually had it more of like it counted as lab hours. They just were done asynchronously.
And then Stephanie, I think you guys used a scheduling tool as well. Is that right? So students would schedule their own time. So you would have just slots open that the lab was open every day, and they would
Yes.
schedule their, so that way it's very easy to get it kind of organized for them, and ensures there's plenty of opportunities to get in. So
Yeah, we used bookings and our lab was open Monday through Friday, 9 to 5.
yeah, makes sense.
Bookings was our scheduling tool. It's part of if you have Microsoft Office, it's actually part of the suite. That's why we used it, because it didn't cost anything extra. It also allowed the students to schedule or change, and it would send them reminders. And we could set how many students were coming in, and we could block off for like faculty meetings or, holidays, things like that, so that they wouldn't be in there when we wouldn't schedule when they couldn't be in. And then there's one for a list of our VR scenario as well. I don't know if you saw that one.
We can definitely send you that. Oh, here it is. So we do have a list. It covers all specialties. So you can think med surg, critical care, psych, peds, OB. We have specific ones for fundamental students, leadership, all of that, and also APRN even for your graduate programs. So yes, definitely we can send you that. We usually cover those kinds of topics inside of our demos or intro meetings. And actually, let me go ahead and put that in the chat if any of you are interested. So that way you can do that here or save it for later. I went ahead and just pasted that into the chat here if you want to book a meeting with one of our nurses.
And also, Bethy, and I had to learn the hard way too. It was really challenging.
Yeah.
Daniel, we did not usually have faculty in the room. We would have the students would do the simulation and the debriefing, and our debriefing is pretty detailed. It actually will tells them, like, for example, if you're supposed to give morphine, it'll say that you're graded on if you gave the morphine or not, and if you did it correctly. And then it breaks it down even to the AACN competencies and subcompetencies. So it's very detailed. But if they did have questions, they would reach out to their faculty if it was like a sim specific question, like a patient specific. Those are good questions.
They are good. All right, everyone. I think we're going to go ahead and close this. We really appreciate your time. And once again, if you are interested in learning more, there's the link in the chat. And also, we will be posting this recording on YouTube and other social media. So thank you all so much, and we will talk to you all later.